And Dr. Darien joins us once again with one of your health and wellness questions. This one from Chris H. Which over-the-counter medication works better for back pain? Ibuprofen or acetaminophen?
It's a good question.
It's a really good question. The first thing we have to understand is that they work differently. Ibuprofen is an NSAID that stands for non-steroidal anti-inflammatory that decreases inflammation, and acetaminophen, the active ingredient in Tylenol, blocks the signal of pain. And so theoretically, the studies show that if you have back pain, that's usually associated with inflammation, so ibuprofen might help. But you'll typically see us doctors prescribe Tylenol or look for Tylenol more because it's easier on the stomach. And so both of these probably can work equally. Many people do not know that they often can work together in the emergency room, and when patients are acutely in pain, I usually treat them together, but you always want to make sure, especially if you have chronic conditions like kidney or liver failure, or if you're taking medications, that you talk to your doctor first, because even over-the-counter medications can interact.
Well, my friend is so smart.
That's what they tell you to do with babies too, to rotate the two.
I like rotating with babies because it helps to keep you on track. I talk to a lot of parents, and the fear is that I've given too much of one thing or the other, so alternating can also help you decrease that risk.
Got to be careful with that. Your prescription for wellness.
My prescription for wellness is on food sensitivities. I was thinking about a lot about this over the weekend. Many of us live with food insensitivity. Our body can't break down certain things, and we don't know it. If you feel like you're waking up feeling groggy, if you're feeling bloated, it might be associated to your diet. So here are some tips and tricks that we can do to investigate food sensitivity. The first is check for symptoms. The most common symptoms you want to look for are things like GI symptoms, abdominal pain, diarrhea, nausea, vomiting. Obviously, those are clear symptoms that you might be associated with your food. And then also looking for non-GI symptoms. That can include feeling fatigued or flushed or having body aches, and it can be unexplained. Again, you want to check to see if that's associated with what you're eating, and look for the common causes. That includes things like lactose in milk, gluten in our wheat products, and sulfates, even in things like wine and beer. To keep track, you can keep a journal and investigate whether or not your symptoms are associated with that, and even try an elimination diet. This is one of those things where I actually help or encourage a diet in that setting. I don't think diets work overall, but an elimination diet where you get rid of certain foods to assess your symptoms for a period of time and then slowly add them back can be really helpful to investigate whether or not you have a food insensitivity.
And sometimes you're just getting old like me. You can't eat the same things that you used to.
We talk about it during the breaks. You can't eat the same things or drink the same things that you used to.
All right, Dr. Darien, well, thank you very much for that. I appreciate it. Receive. Folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions for my good friend, Dr. Darien.
Sorry, I think he just called you out on that.
You were something else, man. Coming in hot. You missed me, didn't you?
I'm trying to be accurate.
You asked his advice this morning.